Hi, I'm Kelly, a registered respiratory therapist with Blue Zone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.
Hey there, Gina from the Cozy Lung Lounge. Welcome back, listeners. I'm here with Amy.
Hey everyone, it's Amy.
Kelly is out of commission today helping a friend, so we're going to move along without her. What we're going to talk about today is a frequently misunderstood word. It's a big word. It's called bronchiectasis. Bronchiectasis is a mucus-producing disease. What do you know about bronchiectasis, Amy?
Well, the biggest thing is it's a chronic condition that causes permanent widening and dilation of your bronchi and your bronchioles, which are some different small airways within the lungs. So this is something, like I said, that's chronic, that leads to a lot of mucus production, a lot of mucus pooling. It can lead to recurrent infections and inflammation and really have a big impact on your breathing overall.
Yeah, that's right. I see a lot of patients with bronchiectasis, and that mucus is really the driver of that disease. And we'll talk a lot about that here coming up shortly. But we also talked about, as a strange word, it's also confused with bronchitis, which we're going to talk about in a different episode. But bronchitis has more to do with some airways. Bronchiectasis is structural changes in your airways. And so really bronchiectasis is more than just a cough. It's a lung architecture problem.
And it can be caused by several different things. So the biggest two that I normally hear about are chronic infections. So having back-to-back infections, whether that's bronchitis or pneumonia. And then the other thing is obstructions. So whether that's a tumor or whether that's something that's gotten lodged in your airway, some sort of foreign body, those are the main two things. And then we also have some different immune deficiencies that may cause bronchiectasis.
I have a lot of patients that, well, to back it up, you would think bronchiectasis would be related to smoking, like all of our other COPD kinds of diseases. Bronchiectasis can be an obstructive lung disease, but this one sometimes is not related to smoking. Like Amy said, an infection might cause this problem, and the infection is what's driving the mucus and the pooling in the airways. And then if the mucus can't get out, we have some more problems going on. So it could be for anybody. We've got lots of people out there that have bronchiectasis that have never smoked any cigarettes. So it's an equal opportunity kind of lung disease.
And that's why it's important to protect your lungs. And if you do start to experience a lot of inflammation, like unmanaged asthma or a lot of recurrent infections, it's really important to just keep mind of that and talk with your doctor, see if you can find out a way to help prevent those from happening so it doesn't turn into bronchiectasis. Because when you're sick and when you're fighting off different infections or inflammation, you have something called neutrophils, and they're really great in fighting off the pathogens, but they do release some things that cause some collateral damage within your lungs over time. So the more and more you have those chronic infections and chronic inflammation from an unmanaged condition, maybe like asthma, the more you have that damage and that permanent dilation of the bronchi and bronchioles.
And you're right, Amy, asthma can lead to bronchiectasis because asthma is a mucus-producing disease. If it gets stuck there and can't get out, gets an infection, it can lead to that. Now, some of the warning signs of bronchiectasis is a chronic daily cough, lots and lots of coughing, mucus coming out, or maybe it's stuck in, you can't get it out. But really, it's a mucus-producing disease. You're going to probably have frequent respiratory infections. You may cough up some blood in the airway. Fatigue and weight loss could happen in some cases, and you may be wheezing and short of breath. So if you're having all of those things, the doctor's going to need to dig a little bit deeper to find out what's causing those problems, especially that cough and mucus. When your cough has been going on and on and on, your primary care doctor very well may give you some antibiotics, which is a very good thing to do. But if you continue to cough and your cough gets worse despite the antibiotics, you're going to need some more kinds of testing done. Some of that might be a CAT scan. And really, nowadays we have these really high resolution CAT scans that see all kinds of things in great detail. And so we see a lot of bronchiectasis on the CAT scan. When you see that, you may see some different terms like tree and bud imaging, a lot of really detailed things on the CAT scan, but your doctor can certainly interpret those for you. You're going to come see somebody like me or Amy in the pulmonary function lab, and we're going to do some pulmonary function testing to see if there's any obstruction or any restriction. Quite often you have some obstruction because it's an obstructive airway disease like some of those others. We're going to check your sputum to see if there's anything in there. Pathogens, you see a lot of these MAC infections, the Mycobacterium avium complex bacteria. It is kind of like a tuberculosis, but it's not. I often call it MAC, and that's what you'll hear it referred to. And it's an organism that causes some really long and really nasty infections that are very hard to clear. It may take 1 to 3 years to clear these infections. And once you're clear of them, you don't want to get it back. And so, so sputum cultures really are very important for that. And the last thing, you're probably going to have a lot of lab work done with your blood. You know, what other kinds of tests might you have, Amy, for bronchiectasis?
I think you hit the main ones. I know the gold standard is that CAT scan or CT scan that looks for that dilation of your blood vessels. And like you said, also doing the sputum cultures. And then there's also labs that can be done to look for your immune function, especially if you're having those recurrent infections. And, you know, another thing that they may do is if you're having recurrent infections, they may try to find the root cause of that outside of the bronchiectasis to see if we can help manage that. Maybe there's an autoimmune disorder that you didn't know that you had that may be leading to some of the development of the bronchiectasis.
Hi friends, this episode of the Cozy Lung Lounge is brought to you by Hoot and Annie Joy, where your health and wellness take center stage. At Hoot and Annie Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootandanniejoy.com to explore the programs and choose the one that fits your journey best. Hoot and Annie Joy, because your health deserves a little joy.
And now, since bronchiectasis is a mucus-producing disease, it's probably pretty easy to get a sputum culture. Less common, probably, to get a bronchoscopy with this disease, since you already have some sputum and you can get up. Really, that high-resolution CAT scan is going to reveal that airway dilation and the mucus plugging that X-rays often miss. Now, we talk about these airways that are misshapen. I've seen a couple of different ways to describe it to people. One that I really like is that if you think of a road, a surface of your road outside your house that might have some potholes this time of year. I know in my area, there's a lot of potholes on the road. And so on a nice day like today, the sun's out and the road's dry. But then we're in spring, it's going to rain. And so those potholes are going to get filled with mud and sludge and all kinds of things. The water in those potholes is going to be the last thing to clear up. And so that's much like your airways. You may be able to get a lot of that mucus out of the airways, but those pockets will hold and harbor a lot of that mucus. I've also seen it like a garden hose. So your garden hose with bronchitis is nice and smooth. Bronchiectasis is much more misshapen. It's an old garden hose with little blips and blebs all over it. So what do you think of those? Amy, does that seem to paint a better picture of bronchiectasis?
Absolutely. I think this is a really good broad overview of kind of what goes on, and then also how to find out that it is bronchiectasis. And, we've got lots of different treatments and management for this. So like we said, it is a chronic condition. It doesn't ever go away, but there's lots of different ways that we can work on managing it. So if this is sounding scary and sounding overwhelming, there are lots of great management techniques and treatment techniques nowadays. The first of all, is the airway clearance therapy. So this is something that Gina loves to talk about, is the airway clearance. So I'm going to let her take it with that, especially when you talk about the fact that you're overproducing mucus. And also the other thing that can happen is cilia dysfunction. So those little hair-like structures in your lungs that help clear out some of that congestion, a lot of times bronchiectasis can lead to dysfunction of the cilia. So airway clearance therapy is going to be a really big piece of bronchiectasis treatments.
Now, we didn't talk about that test for primary ciliary dyskinesia, but there is a imaging out there where you can see the cilia and the airways. This will be waving, much like you would see in the ocean. There are tests for those. I'm not an expert at those. I should have looked that up. But I do know that they're also growing cilia in a lab in Indianapolis. And so there's ways to replace that and have it growing on tissues. So a lot of really exciting things in some of that airway research these days. But, I'll go back to airway clearance therapy because that's where we really need to be. Coughing, deep breathing, the huff cough. We've talked about vibrating exhalation therapy. So vibrating positive expiratory pressure is what it's called. You blow through it and it vibrates your airways. Those are really important therapies. Very easy to do all of those. If you need to step up, then you're going to get a vibrating vest. Many manufacturers of those, they'd fit it around your body and it just shakes you up real good and gets all of the mucus out. Many people will use that for 30 minutes, at least twice a day. Really, really important to get that mucus out. Even if you don't feel like it's there, you need to get it out. Or do you need to get it out? That's one thing I did ask my pulmonologist mentor the other day. Is there more bronchiectasis now? And what should we do about it? Because the high resolution is picking up on a lot of bronchiectasis that we didn't know about before. But we haven't done the studies, he said. We don't know if getting that mucus out makes people better or not. We would assume it would. But if you're not having symptoms, do you need to go to all of these lengths? That's something of a lot of debate right now. But really, we do know that mucus pooling in the airways causes infection. So getting it out the best way you can is really important.
If you're looking for more information on the mucus clearance therapies, I know, we touched on it briefly in this episode, but we're trying not to bog us down too much with that. Check out, I think it's season 1, episode 31 of our podcast goes through a whole episode. I think it's about 30 minutes long, just on mucus clearance therapies. So go back and check that episode as well if that's something that you're really interested in learning more about. But moving on, we also have some different medications that can be really helpful for bronchiectasis. So the first one is just what we normally talk about, which is your inhaled bronchodilators. And you've also got your mucolytics, which are another inhaled medication. Bronchodilators with bronchiectasis doesn't even make sense to me. Gina, do you know why you would use bronchodilators when you've got bronchiectasis?
And so that's really a gold standard. And it's kind of a joke amongst respiratory therapists. Everybody gets albuterol for everything. But, if you have some component of asthma, which many people do, you would want a bronchodilator. Sometimes it does help to move mucus. So if you have some obstruction, that might relate to those bronchodilators. The other thing is a common mucolytic called mucomist is not great for your lungs, your airways. They may tighten up or cause a bronchospasm with that mucomist. So having a bronchodilator paired with a bronchospasm causing medication will be really important. So many ways to inhale. There's also 6%, 10% sodium chloride, which really helps to get that mucus moving well. So many things can go inside a nebulizer.
And then we've also got antibiotics. So I know we were talking about those chronic infections that tend to happen. So antibiotics can be really common if that's something that somebody experiences when they have bronchiectasis. So that's going to be kind of any time you've got an infection going on, they'll just start you on antibiotics, whether that's oral, IV, or inhaled antibiotics.
Of course, with any lung disease, we're going to make sure you have your vaccinations done, flu, pneumococcal, all of the things you should have, COVID, so many, whatever the recommendations are for you, keep your vaccines up. You're always going to treat the underlying cause. So if you have cystic fibrosis that causes your bronchiectasis, you're going to be on a very different therapy. Cystic fibrosis has a whole lot of things, but there is crossover. I set up a vest the other day on a lady with bronchiectasis, but I used a cystic fibrosis protocol because she wanted enhanced mucus moving. So some of those things cross over. If you've got immune deficiency, of course, you want to booster your immune system as much as you can so that you're not getting the infections. And then if you have COPD, you're also going to be doing all of the nice things for COPD as long with treatment for your bronchiectasis.
Well, and the other piece is exercise. Exercise is another really great piece just for helping with some of the symptoms like shortness of breath. But I would always make sure that you're kind of pairing your medication that you're taking, whether it's your bronchodilators or your mucolytics, with your airway clearance therapies before you go to exercise, because you don't want to be coughing and dealing with as much mucus when you're trying to do some physical activity, because it's really going to prohibit you from doing as much as you'd like to do. But I always just want to remind everybody to continue to do physical activity. It's really great for your lungs. It increases your blood flow to your lungs, which may potentially help with some of that mucus clearance as well. But the one thing I will say is don't become dehydrated from exercise. Make sure you're drinking plenty of water, keeping that mucus really nice and thin so that you can get it out easy. But always starting at a in-person pulmonary rehab is a great place to start if you can. And then moving on to exercise maintenance outside of that, whether it's an online program like Blue Zone Health, or if you like to go to your local gym, whatever that may be. It's important to talk with your respiratory therapist and your pulmonologist, whoever your team is, to figure out the best way to enter into exercise or how to continue on safely with exercise if that's something that you're already doing.
Boy, exercise is such an important thing for every everything that we do in our lives. Boy, it's just such an important thing. There's a little bit of research on the horizon with bronchiectasis. There's a drug called Brinsupri, which is supposed to be out there to reduce exacerbations. And so this helps to prevent those flare-ups. And so it's a complement to any other therapy that you're on. And since it's so new, that's something you'll want to talk to your doctor about. But there is research in this area. There's just so much you can do in bronchiectasis, but really making sure that you keep your airways clear with all of these recommendations that we have can really change your life. If you're out there on YouTube, there's other bronchiectasis experts that you might see, and they have some really great information to provide that are specific to bronchiectasis. But it's a progressive structural lung damage disease. We just want to really keep on top of it. The less damage we can have, the better we can protect your lungs for the long term.
Absolutely. Well, I hope that we hit all the major topics of bronchiectasis for you guys. If you do have any questions, please feel free on whatever platform you're listening to reach out and ask your questions. And we'll just see you guys for the next episode where we're going to be talking about chronic bronchitis.
Thanks so much, everyone. It's nice to see you in the Cozy Lung Lounge. Bye.
Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At Blue Zone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit bluezone.health and take the first step towards stronger lungs and a healthier future. Blue Zone Health. Breathe better, live better.